Britt, Chairman of the Bladen County Board of Commissioners. I'm joined by Bladen County Health and Human Service Department, Dr. Terri, Duncan, and Bladen County Emergency Service Director Nathan Dallas. As Chair of the Board of Commissioners, I'm pleased that we can share information on actions your county government is taking to help protect our citizens from COVID-19 and to prevent the spread of COVID-19. Our board has the highest confidence in our county officials, including Public Health Department, Sheriff's Office, and Emergency Management, to lead a coordinated effort in this evolving pandemic situation. Please know that the health and the protection of our citizens is our top priority, and we are working in a coordinated and diligent manner. Now, I will call on Terri Duncan to provide an update from the Bladen County Health Department.
First, I'd like to start off by saying that we have no confirmed cases of COVID-19 in Bladen County. There are currently 40 cases of COVID-19 in North Carolina. Only one of those cases has required hospitalization. Those cases are spread over 14 different states. Consistent with the North Carolina Department of Health and Human Services, we will report any positives. This information will be available on the North Carolina Department of Health and Human Services website. This situation is rapidly evolving, and we know that this type of pandemic can spark fear and anxiety. We encourage citizens to seek information on COVID-19 from the credible sources such as the North Carolina Department of Health and Human Services and the Center for Disease Control website. In an effort to stop the spread of the virus, the governor has issued an order to ban gatherings of more than 100 people. CDC has recommended no more gatherings of no more than 50 people, and President Trump has recommended gatherings of no more than 10 people, the closing of schools, and to practice the CDC guidelines of social distancing. Bladen County strongly recommends that our citizens follow the orders and guidelines. Social distancing means standing at least 6 feet away from people when positive. We recommend that people at high risk of COVID-19 stay home as much as possible to mitigate the possibility of getting infected. High-risk individuals include older adults, seniors, or citizens with chronic illnesses such as lung disease, heart disease, and people with weakened immune systems or other respiratory illnesses such as flu. We also encourage common health practices such as washing your hands with warm water and soap, hand sanitizer when hand washing is not possible, and covering your mouth and nose when coughing or sneezing. Presenting symptoms of COVID-19 are fever, coughing, and difficulty breathing. If you present with any of these symptoms or think you may have been exposed to COVID-19, we are asking you to first stay at home and call your local health provider or the Bladen County Health Department before you come in. Let them ask questions and do an assessment over the phone. It is not necessary for everyone to be tested. Certain criteria has to be met before a test is done. This allows us to take protective measures before you come in to this office or the agency and to not overwhelm our healthcare providers. Please call your provider or doctor's office before you come in. The Bladen County Health Department will be establishing a hotline, and we will release that number as soon as it has been obtained, so that our local Bladen County folks will be able to call that and not have to get in the queue for the state agency. That phone line is getting quite clogged. I want to thank our citizens, our local healthcare providers, and our emergency workers for everything that they are doing to prevent this virus in Bladen County.
And I won't repeat everything that Dr. Duncan said, but just I want to give an update to the citizens on county services. Although it's our goal as a county to keep services operating on a normal basis and what citizens are used to, the spread of this virus, there are some county services that we provide that are going to be changed or modified or interrupted. Certain things that I know certainly the public has seen these on different news outlets to the county. Our Parks and Recreation services are suspended, I think, until April 6th. Our county parks are open, but they are not taking reservations for any organized practices or anything like that. Those citizens that have been to the tax office or the courthouse in the past week or so have noticed that there's hand washing stations outside. We strongly encourage citizens before they come in the building to wash their hands. For the recommendation, 20 seconds, we've all heard it, warm water. Also, we are encouraging citizens, water bills, tax bills, things like that, if you can utilize pay by phone, online services, mail-in payments in, drive-throughs. We have a drop box for tax office payments and things like that. We strongly encourage you to use those services that are provided to you by the county, and this helps with coming into county offices if you may be affected and things like that. The sheriff's office, we've been in close contact with them. They've made some restrictions on some things they're providing as far as concealed carry permits and other things of people coming into office to, just as a county, be responsible in helping in spreading and prevention of this COVID-19 pandemic. A few things that emergency services has had calls on is clarification on the orders and the recommendations. As of right now, it is an order by the governor, mass gatherings of 100 people is an executive order. So that order, that is an order that it can be enforced by law enforcement. The CDC recommends gatherings of 50 or no gatherings of 50 or more, and the president is recommending gatherings of no more than 10 or more. So keep in mind, the 100 is an executive order from the governor. CDC and the president are recommendations. With that being said, as a county government, we are recommending that you follow the recommendations of the CDC and President Trump if need be. 50 or more. This does include church services. So we are recommending that. That is the stance of the county on that. So just wanted to clarify any, before, if we have any questions or any emails that come up at a later time, wanted to clarify that. But we do encourage citizens. I'm not going to repeat everything that Dr. Duncan said, but we do encourage our elderly population and people that have ongoing illnesses to stay at home as much as possible. And I want you to know that your local government, emergency management, under the direction of the health department and our board of commissioners, we are working with the health department to provide them with what they need for our citizens if the time comes, or we do have a case. If it needs to come that we need to declare a state of emergency or anything like that, we do want the citizens to know that we are prepared to do that. We are prepared to open the Emergency Operations Center if that time comes, and we're working not only with with our local health department. I know Dr. Duncan and Health Services is working with their state partners at DHHS. We're working with North Carolina Emergency Management, and also our local partners, Bladen County Hospital, Cape Fear Valley Main Campus. So I do want to ensure citizens that we are making preparations if they need to be done, and if you need anything, this number, as soon as the health department gets it released, will be manned, and we'll be taking calls on that.
Mr. Dallas, Charlotte Smith here with Bladen Online. You said that it could be, if someone is found in violation of the mandate, it could bring criminal charges. Do you know what those charges would be?
I do not. Me as emergency management director, I do not have the power to arrest anybody. I think in the executive order, I do think in the executive order it does talk about a misdemeanor, but I'm not exactly sure on that. And that order, keep in mind, just to clarify, is for 100 or more.
That's a class 2
Yeah,
misdemeanor.
class 2 misdemeanor. 100 or more is a class 2 misdemeanor.
And Dr. Duncan, have you heard anything about child care and what daycares and those type facilities are to do during this time?
Just came from the governor's conference that he had at 2 o'clock, and they are allowing daycare centers to stay open for several reasons. One, we need them to take care of the healthcare professionals, the emergency workers, the folks that are going to be manning the grocery stores. And one thing, grocery stores and pharmacies are allowed to be open. So we do need folks to be able to care for those children so that those people can come to work with a good conscience.
And how many people do you know have the flu in Bladen County?
We have, right now, you're at more risk for flu than for COVID-19. However, the risk is growing for COVID-19. So the same things that we would be doing to prevent COVID-19 are exactly what we need to do to prevent the flu. We need that social distancing. We need to not gather. We need to do hand washing, and we need to do respiratory etiquette.
And I have another question. What do people do that don't have health insurance? Can they get a test, and if so, where?
If the test is needed, first of all, they have to meet criteria as established by North Carolina Department of Health and Human Services with the CDC. And if they meet criteria, then they will have no problem getting a test.
Do they just go to the health department?
First, we're going to, if they will call us, then we're going to facilitate that happening, because we would do the screening to see if they met criteria.
And your phone number, is it on your website, or do you know the phone number?
The phone number is 910-862-6900, and we will have, hopefully starting tomorrow morning, the hotline.
Okay.
Ms. Smith, I think it's important to know that these folks sitting here today, and some of the ones out in the audience over here, has already had 4 or 5 meetings today. They're fully abreast. They're paying attention to what the state directives are. It's been an exceptional effort on everybody's part working together. It changes about an hour, and rest assured they're staying on top of it, and very professional, working well with the school system, because that's a big, tremendous need with children with food. The college is also working well with us as well, Sheriff's Department. And so we've got the people's heart and interest in mind and their health and welfare. And it's a major task that's being taken. But they're just not only working about today, they're working on next week in advance, being proactive. And proactive is where we have to be. And some of these measures may look a little strong right now, but rest assured we're trying to be proactive to make sure that things are well.
Is there anything about small businesses? I have people asking what small businesses need to be doing.
So there's not any guidelines on small businesses as of yet. We did learn from the governor's press conference at 2. There's another executive order on restaurants and bars. Takeout service and delivery service are allowable, but no sit-down dining services are allowed for restaurants at this time. And what that means, to clarify, if you walk in to get a prepackaged meal, you can walk out with it. You just can't sit down in the restaurant and eat it. So that's the limitations on that right now. And from my understanding, I haven't got the executive order yet, but from my understanding from the governor's press conference, that is an executive order. So that would be enforceable also. And we got some people shaking their head that it is an order. I also wanted to talk a little bit too, and I know a lot of people have heard this. I know the governor said it. I know President Trump has said it. Food and hoarding food. We do recommend that you be prepared for isolation for an extended period of time, but we do want to encourage you not to hoard more than what you would need for a week or so, because there are citizens out there that can't afford to go to a grocery store and buy $500, $600 worth of groceries at a time. They have to go on a need-to basis to buy their groceries. So we are encouraging citizens to be prepared, but do not go overboard with it, because everybody needs some. So just wanted to encourage that, and I think Dr. Duncan was going to talk about the school a little bit.
So the schools are open for breakfast and lunch at 7 different sites, and yesterday they fed 318 and today over 600 meals. So we know that there were children that needed nourishment, and that's for any child that is age 0 to 18 years old in Bladen County, no matter what school.
So do they just call? Do they have to have their child's ID in order to get the meals?
They just have to present, and we're believing that our public is faithful and that they're honest, and they can obtain meals, and not only for themselves but for someone else if they could not come. We also are identifying different parts in the county where there may be groups that can't come, so we're working out so that meals can be delivered to them.
And they're to call the school principal if they can't get the food, or?
If they'll make contact with the schools
Or with us. If they'll make contact with us, we'll see that the school gets the information.
Okay. Someone asked, the First Amendment of the Constitution says the government can't dictate to religious organizations. Have you heard anything about that? Do you know how to answer that question?
The direction we got from our executive order is no gatherings of 100 people or more. That is the executive order we have. It does not specify churches or any. It does have some exceptions in there in the beginning, as far as restaurants and malls and things like that, but those exceptions did not address churches. So we have to take it at face value for what it is, gatherings of 100 or more.
Right.
I certainly understand the First Amendment and all that, but we have to take the executive order for what it says.
And just to note, because we are looking out for each other, and people that may be going to any organized event and leaving that event and going somewhere else, if you were to become infected, it really is important that we follow. And right now, these are suggested, some of them. But as we know, Governor Cooper did suggest that some folks do some distancing, and now he has had the executive order for the restaurants and bars.
Thank you very much. Any other questions? We're good?